Today's topic is talking about Infinix's enhanced eligibility and verification product. It focuses on our upgraded version of this offering. We call it Generation 2 of our eligibility verification and benefits extraction. So I'm sure all of you are aware of the eligibility and benefits process and are aware of how important it is to the patient access process and the revenue cycle management, right? We understand that when a patient's eligibility is not ratified at the point of patient visit or prior to rendering procedure or treatment or visit, there is a chance of not getting paid for that service that was delivered to the patient. And if the patient, let's say a patient has a payer on file, but still is inactive with that payer, you still have that chance of not getting reimbursed by the payer entity. So very, very critical from a revenue cycle point of view, very critical from making sure that providers are getting paid for these services rendered. Additionally, it's also important to know the patient's benefits in order to collect the patient's portion of the amount that is owed, right? So if you can verify patient's eligibility and are able to extract the benefits, right? What is the patient's deductible, out-of-pocket, max, and then the copay or the co-insurance, you can collect that upfront. And that has a lot of benefits here, especially in terms of cash flow for providers, ensuring that that percentage, whether that's 10, 20, 30%, or more of what is owed, is collected in a duly fashion, not just from a cash flow point of view, but also increasing your probability of getting that, right? Because as we know, once you send the invoice or the bill out in mail, the probability of the patient paying it reduces. So very important from getting paid from the payer entity, getting paid from the patient. And then we can talk about just other implications of this, right? What are the other challenges when it comes to securing eligibility and benefits? And of course, there's effort associated with obtaining this. You have staff out there that is dedicated to going onto portals and checking this, or picking up the phone, making phone calls, or perhaps you're working with a vendor, or you're using the capabilities of your EMR or EHR that has some ability to get or ratify patients' eligibility and get some benefits. Now, each one of them, I think, has some pros and cons. And then I will compare each one of these options to Infinix's enhanced eligibility and benefits offering, right? Of course, if you are manually checking eligibility and benefits with your staff in-house, that's a very high cost associated with it. The physician survey a few years ago had a number that said each eligibility and benefits transaction to obtain that value manually can cost a provider up to somewhere around the $9 region. And you can wonder, hey, but it's just getting eligibility and benefits. Why does it cost so much? And that can really vary in terms of the specialty that you're looking at. If it's say an imaging versus a chemo versus a surgery, the type of benefits that you're trying to get, say for a PT, OT, or a therapy clinic, you're trying to get some additional details such as related to the service quantities and referral requirements. A lot of these cases, you're having to not just look at one portal, maybe look at multiple portals, or not just look at a portal, but also make a call. Maybe you want to check auth requirements. So it really adds up in terms of effort. And when you compare the ability to get all of this in a seamless manner. That is typically what a vendor should be offering you, right? If you're working with a vendor, you should be working with a vendor in order to achieve outcomes such as always getting accurate benefits, because that is very important. You don't, I hear this all the time that, hey, we've worked with a vendor and they say they give real-time eligibility benefits, but 40% of the times we can't even rely on it. It has wrong deductibles, so we get wrong copay co-insurances. So accuracy still should be one of the most important things, because that directly correlates to how much you're collecting and your ability to collect. But then, you're using a vendor to ease your burden, right? So that you can use your staff in more optimized manner for tasks that they can be more useful for. So you want to make sure that this whole process is more seamless and you're able to achieve these results faster, more reliably. So you want to have that real-time nature when you can, so that, say, upon patient's arrival, you can quickly check the benefits too. So that real-time nature of it. And then you also want a vendor that is comprehensive in terms of what they can check for you, right? You don't want a vendor that says, hey, we can only do this for just your MRIs, but we can't do it for your surgeries or for your lab related services. You want the ability to be the vendor to be comprehensive in terms of what kind of load they can manage. So that is, I think, where some of the other options that I talked about earlier, which is either using your EMR or using some other vendors out there, fall short. They're able to provide some of these benefits, but not all. So let's start with EMRs, EHRs. I think EMRs and EHRs are good because, this capability comes bundled with what you're already using. It's easy from your point of view, but so many times I just hear problems with either accuracy or just not getting the details you want to get, right? So, okay, I'm told that this patient's eligible and I have an out-of-pocket maximum, but there's no deductible. So I have to go out and just get it myself anyway. So you're duplicating effort and you're unable to rely on what your EMR is sending you. So in terms of just the quality of the output, I've typically seen that EMRs essentially are not at par. And then we can talk about other vendors out there, right? These real-time eligibility benefit vendors that claim to be doing a lot of this. I think where they fall short is also in the ability to either be comprehensive or be real-time, right? So say that we have a lot of these real-time eligibility vendors that say, okay, we can automate X percentage of your cases and give you real-time eligibility and benefits. Great, but more often than not, when they say that, hey, we can automate 80% of your volumes, what they mean is we can automate the ability to give you a payer response for 80% of your volume. That means that whatever the response is from the payer, we'll just make it available to you. Now, what that means is majority of the times, there is more work for you to do. So you'll get a response that says, okay, patient's eligible, great. But then when you look at benefits, you will be shown a long list of all the types of benefits, right? For different services, for in-network, for out-of-network, for individual, for families, for different place of service, office, specialists, ASCs, home health, whatever might be relevant to your use case. And you still have to look at that document, sift through it, and extract what is most relevant to your scenario, to the patient that's coming in. Now, this is also just restricted to what I call standard benefits, right? If you have something that you want in addition to, say, your deductibles, out-of-pockets, copay co-insurances, that's something that a lot of these vendors fall short on as well. So let's say you want to know referral requirements, or you want to know authorization requirements. You want to know the limit on services associated. Very hard to get this information. And the reason for that is most vendors use what we call clearinghouses to automate the eligibility and benefit requirements. And they typically have one clearinghouse they're working with, right? Clearinghouses are entities that are connected to a set of payers to facilitate the electronic request and retrieval of eligibility and benefits. And they're solely relied on the one clearinghouse. So if that clearinghouse is down sometimes or has issues, they're unable to process your requests. Also, clearinghouses have their own idiosyncrasies and nuances. So you're restricted to the nuances or the limitations of the clearinghouse the vendor is working with. And the clearinghouse itself, right, which is the EDI 270, 271 standard, is unable to provide you some of these additional benefits that you sometimes may or may not seek, right? Like referral requirement, auth requirements. EDI 271s are notorious for giving inaccurate values for auth requirement. If you rely on that to say that, hey, they said auth not required, a lot of times you'll see that auth actually was required. So that can be a scary place to be in. So that is, I think, one major limitation. And then the other limitation is there are some vendors who are able to parse that response into specific benefits, such as, hey, what is the deductible that is applicable to you? What is the out-of-pocket that is applicable to you? What is the copay or co-ins applicable to you? And the problem that they have is they fall short on that parsing logic. So oftentimes what you'll hear from providers that use them is, oh, the copay or the co-insurance was inaccurate. They picked the wrong deductibles or the wrong copay co-insurance. So let's get to Infinix's enhanced eligibility and benefits offering. And let's talk about how, having an understanding of where, the manual mode or the EMR mode or the other, let's call them eligibility benefit vendor modes, fall short and the challenges that are faced. Having an understanding of that and having solutions that specifically target each and every one of those, so that at least we try to offer something that is accurate, comprehensive, reliable, and as fast as possible, right? Whether that's real time, when we can achieve real time, or if we can't achieve real time, we try to still give it as fast as we can. Starting with what the Infinix offering is, it combines multiple modes of automation and electronic channeling of the eligibility and benefits request. So we don't just use one clearinghouse, we actually use multiple clearinghouses, so that one, we get a very big network of payers that we can work with. We rarely find a customer where we don't cover, 98, 99% of the payers. And the only ones that may not be covered are, some small local payers or regional payers at times. So what that also allows us is that if, the output from one clearinghouse is incomplete, we actually go to another clearinghouse to complete. Let's say deductible was missing in the response that we got. We can actually check with another clearinghouse to see if they're able to provide us the deductible. Additionally, if one clearinghouse is down for some reason or is having network issues, we can just use another one. But we don't stop there, right? Because like I said, there are times where, depending on the type of clinic or provider you are in terms of specialties, you may require additional information that is not provided by clearinghouses such as auth requirement, referral requirements, to name a few. So what we've done is Infinix has its own proprietary robotic process automation platform. So we have built bots that can run against payer portals to augment the information so that we can give you exactly what you want, right? Say we have been able to get eligibility benefits from a source X or from our clearinghouse method, but we know we can't rely on them to get auth requirements, and maybe they don't give us referral requirements, right? So we have a bot that can run against the payer portal and check against, say, the prior auth benefit manager or third-party administrator to check the auth requirement, and then similarly get the referral requirement as well. So we've combined a lot of different modes of automation to ensure that, again, we reach those outcomes and those metrics that we want to provide you. And then we also have, the product also comes with a workforce management capabilities and work allocation capabilities, so that in the cases where things do require manual intervention, you can easily assign the work to someone and get that worked on, whether it's our team or your team, right? We offer the product in both models. If you want to outsource 100% of your volume, we use our product, and then we have a team of specialists that can do the exception handlings, or you can use our product and your team can do the exception handling.